The combat tourniquet, designed by the military to stop extreme bleeds. Very effective. Put it on a limb in conjunction or after other methods of controlling bleeding haven't worked. When you put it on and you open it out of its packet, we always say slow is smooth, smooth is fast, because there's a lot of intricate parts that can get tangled if you're not careful. Open it up, get the torsion bar ready so that you can tighten it, extend it out as much as you need to, and you'll usually find, especially with a real injury, that it's easiest if you completely undo it to put onto the casualty. With a limb, arm or a leg, put it up high and put it on tight. When you put it on, try and remove any clothing. So even if you need to cut the pants up here so that you can put it directly onto skin, saves that when you're moving the patient, the clothes don't move and loosen the tourniquet. When you put this on, wrap it right around through the buckle and pull it nice and tight before you Velcro it. As much Velcro as you can so it doesn't slip. The torsion bar needs to be tightened multiple times until bleeding stops. Usually that means on a leg especially, grabbing it, pulling it and tightening it. It's going to end up very tight and can be very painful, but is required to stop a bleed. Keep going, keep going, keep going until the bleed is completely stopped. To secure it, place it in to the holder there and secure it both using the strap through it and then the Velcro over the top. Good reminder here to write the time directly onto the tourniquet. Ensure that the tourniquet is not covered so they can see it when you evacuate. It's also added to a patient's notes when you write it down. If the tourniquet is not tight enough or is not working, expect to have to put another tourniquet on if you can, above the next and even a third. A lot of casualties come in with 2 or 3 tourniquets before they get into the emergency department. This can stay on for as long as you need to stop the bleed. The bleed is going to kill the person, not the tourniquet. Very important. If you're a long way away from help, you can use a satellite phone or anything to talk to an expert that can tell you about reperfusing or getting blood back into that limb. But at the moment, the most important thing is to leave the tourniquet on, stop the bleed.